Hi everyone, good evening. So today is the fifth drug in our neuropharmacology series, a very important anti-seizure medication, that is lacosamide. So mechanism of action, so lacosamide is actually a sodium channel blocker. So unlike the other drugs that act on the sodium channels like phenytoin and carbamazepine, here there's a little different mechanism of action, and it does so by enhancing the slow inactivation of the voltage gated sodium channels. And by doing this, it stabilizes the hyperexcitable neuronal membranes and inhibits repetitive neuronal firing. And another minor mechanism of action is by binding to CRMP2 and hence changing the axon outgrowth. So coming to the indications, so when lacosamide was first released, it was initially approved as an adjunct therapy for focal seizures and eventually was approved as a monotherapy for focal seizures. And very recently, it was also approved as an adjunct therapy for primary generalized tonic-clonic seizures. It also has off-label use in status epilepticus as well as in diabetic neuropathy. So coming to the different formulations, so it's available as an oral tablet. So it is available as an oral tablet, and this usually comes in multiples of 50s and 100s. So we have 50 milligram, 100, 150 as well as in 200. And commonly used brands are Lacosam as well as Lacosette. And we also have an oral solution which is predominantly used in the pediatric population. Okay, and the oral solution comes in a 200 ml bottle with a concentration of 10 milligrams per ml. Okay, so oral solution concentration of 10 milligram per ml usually comes in 200 ml. And coming to IV injection, which is used as an off-label use in status epilepticus, it comes as a 20 ml vial in a concentration of 10 milligrams per ml. So this is IV lacosamide or IV Lacosette. It comes in 200 milligrams in a 20 ml vial. It is a concentration of 10 milligrams per. And regarding the conversion rates from oral to IV, remember that the oral dosing is equal to the IV dosing, so the conversion is same. So coming to the dosing, so this is little different for monotherapy as well as adjunctive therapy. And remember that lacosamide is approved as a monotherapy only for focal seizures, whereas it is approved as an adjunct therapy for focal seizures as well as primary generalized seizures. So with the drug called monotherapy, it is initially started as a dose of 50 to 100 milligrams twice daily. So this may or may not be preceded by a 200 milligram loading dose, but please note that the 200 milligram loading dose has to be given under clinical supervision because of the acute central nervous system side effects and the cardiac side effects. And after this, you have to increase weekly by 50 milligram BD till we reach the target dose of 150 to 200 milligram BD. That is a maximum dose of 400 milligrams per day. Now coming to adjunctive therapy, here the starting dose is a little lower. So we usually start at 50 milligrams BD and again may or may not be preceded by a 200 milligram loading dose under clinical supervision. And after this it is increased weekly by 50 milligrams BD till we reach a target dose of 100 to 200 milligrams twice daily. So remember, monotherapy is approved only for focal seizures and adjunctive therapy for both focal as well as primary generalized epilepsy. And regarding status epilepticus, here it is mainly an off-label indication. So it is initially given as a loading dose of 200 to 400 milligrams as an IV infusion given over 15 to 60 minutes. So please always take a ECG prior to starting the infusion to look for the PR interval, because lacosamide can cause PR prolongation or AV nodal block. And after giving the infusion, please repeat one more ECG to look for any PR prolongation. And after giving this loading dose, maintenance dose is 100 to 200 milligrams twice daily. Now coming to the adverse drug reactions, so like the other anti-seizure medications, especially the sodium channel blockers, common side effects are dizziness, vertigo, ataxia, vomiting as well as double vision. And other side effects like tremors, paresthesias, palpitations, dry mouth and tinnitus can also occur. And remember that chronic use of lacosamide can cause depression as well as suicidal ideation. So these are the acute and chronic neurological adverse drug reactions with regard to lacosamide. And the other important system that is involved is cardiac, which is predominantly electrophysiological side effects. And this is mainly because of the sodium blocking properties of lacosamide and probably sodium channel 5A disruption caused by lacosamide. So this can take the form of, as discussed earlier, PR prolongation or AV nodal blocks, sinus bradycardia, and it can even cause tachyarrhythmias in the form of atrial fibrillation, atrial flutter, and sometimes rarely even ventricular tachycardia. And by causing all these, it can cause cardiogenic syncope. And other rarer side effects are raised LFTs, neutropenia, and serious skin reactions like Stevens-Johnson syndrome and toxic epidermal necrolysis, and it can even cause breast syndrome. Now, coming to the contraindications, the only absolute contraindication for lacosamide is a proven allergy or anaphylaxis to prior lacosamide usage. And coming to the pharmacokinetics and interactions, that's an excellent oral bioavailability of 100%. It has an elimination half-life of 13 hours, hence the twice daily dosing. And it is predominantly metabolized by cytochrome P, 2C19. Inhibitors of this enzyme are omeprazole, which can increase the levels of lacosamide theoretically. And inducers are carbamazepine, phenytoin, and phenobarbital, which can decrease the serum concentrations of lacosamide. And it has predominant renal elimination. And coming to the dose adjustment. So in patients who are having severe renal impairment, there is a creatinine clearance of less than 30 ml per minute. Remember that the maximum dosage in these patients is 75% of the maximum recommended dosage. So you know the maximum recommended dosage is 400 milligrams per day. So in a patient who is having severe renal impairment, the maximum dose would be 300 milligrams per day. And it's also worthy to note that lacosamide is a dialysable drug. So after each HD session, we have to give a supplemental dose of 50% of the daily dose. So let's say a patient is getting 50 milligrams BD, that is 100 milligrams per day. So after an HD session, we have to supplement 50% of this. That is an additional 50 milligrams should be given after a hemodialysis session. And regarding to hepatic impairment, in case the patient is having severe hepatic impairment, it is best to avoid lacosamide. However, in case of mild to moderate hepatic impairment, the maximum dose will be 75% of the maximum recommended dosage. That is around 300 milligrams per day. And with regard to pregnancy, it is category C, but however, it is less teratogenic than other anti-seizure medications like sodium valproate or topiramate. And like other anti-seizure medications, periconceptional folic acid at a dose of 0.4 milligrams per day should be supplemented. And lacosamide is also secreted in the breast milk and can sometimes cause drowsiness in the breastfeeding infant. So in female patients who are breastfeeding, it should be used with caution, and unless the risk-benefit ratio warrants so, it should not be used. So this is with regard to lacosamide, and we will meet in the next video.